Welcome to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. At Wellmark, Blue Cross, Blue Shield, our mission is to make healthcare better for our members, customers, and communities across Iowa and South Dakota. We have a responsibility to manage healthcare affordability for our members and customers. Today, I'm happy to have a returning expert, Julie Enga, who is a registered and licensed dietitian. She's from our well-being team, and I'm happy for you to join me in our continuing conversation around the topic of GLP-1s. The last podcast, we talked with Ryan from our pharmacy team, and now Julie, thank you for joining.
Yeah, thank you. I'm glad to be back. And on such a great topic, and that I know is getting lots of airplay, lots of requests for more information.
For sure. So before we dive into the topic, though, why don't you share a little bit about yourself? I know you've shared it before, but always good to share it again.
Yep. Well, you know, we've worked together for quite a while, so this is an old story for you. But as you said, my name's Julie Enga, and I have been here at Wellmark for 25 years. So I've had the opportunity to work in a variety of settings within these walls. Currently, I lead our employer consulting and well-being team, and that is the team that works closely with your staff when we bring out health and well-being products to employer groups.
Yeah, and your team does a great job.
Thank you. Yeah, I'm pretty proud of them. So I'm also a registered and licensed dietitian. So I started my career as a registered and licensed dietitian. And actually, the first half of my career was spent working with weight management and obesity programs. So during that time, I was young. I was really excited to help individuals become healthier. And what I found is obesity is not a new issue, unfortunately. Right. And people wanting to lose weight was one of the top things that was going on at that time and continues to go on. I shouldn't say that.
It's just more and more people are in that situation, which is why employers are asking it of us.
Exactly. And it's just an ever-changing landscape when it comes to health, weight management, and obesity. So I'm excited to be here, especially as we think about some of the newer things in the market.
Well, given that, your passion and your experience there, what are your thoughts about all the information related to GLP-1s and other weight loss medications that we hear about every day?
Yeah. So being in the field for as long as I have always wished there was a magic pill, a silver bullet.
There's plenty of commercials about
magic
pills. Yeah,
there are. And, it's funny, when I was working with clients, I always said to them, this is hard. It's hard work. If I had a magic pill, I wouldn't be sitting here doing what I do. And so when I think about the GLP-1s, there's a lot of information. I'm excited as they continue to develop new strategies to help individuals with weight, obesity. And so GLP-1s to me have gotten the conversation restarted, reignited, and it's conversations we should be having. But in my opinion, there isn't just one silver bullet. Obesity is complex, and it involves so many things. So just bottom line, it's good that we're talking about it, and we should continue to talk about it and think and really work hard on strategies.
Yeah, when you think about the strategies from when you first started to now, what's the biggest change other than GLP-1s?
So the biggest change, Kareem, that's a great question. I actually don't think there are. I think we've really expanded the solutions available for obesity and weight management. So whether that be more programs or more medications or better surgeries, but honestly, all of those things existed when I was working with individuals. It just continues to evolve. So I would like to say, we've gotten a lot smarter, and we've kind of narrowed down how solutions should look and where medication should focus. But again, no silver bullet. And so thinking about that and GLP-1s, to me, that's one tool in our toolkit. Yeah. When it comes to obesity, there isn't a single way to address it. You really got to look at a robust weight management, obesity strategy. And what that means is knowing that not one single thing is going to help individuals with a problem.
Right. Yeah. And I think that's the point, right? They feel like the GLP-1s feel like they should be a silver bullet, but there's still a lot to learn about them, and there's a lot of other strategies that are out there that have been proven and tried. And so when you think about and put your dietitian hat back on, what would you tell someone who's interested in starting a GLP-1 medication?
Well, number one, I would always have them work with their primary care physician. The market is so different today. Actually, I should have said that's one of the biggest changes that I've seen is who all is getting into the market of weight loss, GLP-1s, because it isn't just your local pharmacy. It isn't your doctor just prescribing, your regular doctor. We're seeing direct-to-consumer options. So there's so many ways to get GLP-1. So when I think about working with clients, or even a first step for an employer group, is to make sure your employees are connected with their primary care physician. What we know is individuals that are overweight and obese, a lot of times they have other conditions. Mm-hmm. And so having those regular conversations with their doctor and talking through the best strategies for weight loss or to target obesity really should be done in that primary care setting.
Yep.
So number one thing I would say, what's great, Kareem, is the discussions about GLP-1s is so loud and
I don't think I've been at an employer meeting or a meeting with a consultant where the topic hasn't come up. And definitely some passionate views on it and how it's covered, what can we do, and that leads me to the next question.
Yep.
When you think about an employer that's offering a benefit plan or trying to save money or offer the richest plan or best benefits for their employees that they can, and it comes to the topic of GLP-1s, what are your recommendations when you think about it? They don't want to cover it just yet because, like I said, we don't have enough data. It is expensive right now. A lot of employers don't cover it, but they want to do something.
Yep. One of the first things, and I know the team with your account managers like to do, is really talk to employers about what they're offering today to help support their employees' health and well-being. And that can be specific to weight management, weight loss, obesity, but really, in general, they should know what is available to support, because I know, and they're getting a lot of pressure from employees coming to them and saying, why won't you cover GLP-1? So they need to have in their toolkit, they need to be able to say what they're doing today.
Yep.
In addition, most of the dollars, those questions are about treating someone when they're obese. And so I would encourage an employer to say, what am I doing today to help prevent obesity or weight management, knowing that we have a whole host of people that are dealing with being overweight and obese. So I'm not discounting that, but I'm saying they need to look at the full suite of their employee base. And then there are a variety of solutions and tools that aren't specific to GLP-1s that are available. So when they're looking at ways to support, that benefit cover or not is a very important conversation. And you're hearing them directly, and the costs are overwhelming for them. And so while I know those things could change in the future, they should get their benefits, their support programs up to par, or at some point where they know, if I have a support program and I decide to cover GLP-1s, my employees are in the best position to not only lose weight, but then maintain that weight loss, because that is the other piece, right?
Right.
We got to first lose weight, but then how do we keep the weight off to continue that health improvement?
And I think, like you said before, that's not a new problem.
No, it's not. I wish it was, Kareem, but I feel like I've been saying a lot of the same things for many years, but the medications change, the procedures change, but we're continuing to look for these strategies to really help individuals.
Yeah, so when you think about all those strategies, are there any particular solutions or programs? I know in our last conversation when I had with Ryan, we talked about a few. Is there any that you would suggest or discuss?
Okay, so with all of the information out on GLP-1s, what I am excited to share is more providers are being trained in obesity and really spending time to make sure they know how to support individuals that are dealing with weight management, obesity issues. And that's really important because that's where we want them going, is we want them to be able to go to their doctor and be comfortable in that conversation. When it comes to weight, it's very personal. And I heard from so many clients that it was hard to talk to their doctor. And I think GLP-1s and all the information out there has given many more people a voice and feeling confident in talking to their doctor, which is very important.
That's great.
Again, there isn't a single program that's going to work for an entire employee population or for everyone. And so when an employer group is considering how to support their employees, their families, they really got to understand that there probably isn't just one thing that they need to do. The first thing I would say is make sure they're communicating about seeing their physician and really talking about their health. And we see employer groups do that in a variety of ways. For example, a lot of times that would be in a reward and incentive program. They would actually encourage their employees to have that conversation, and they would reward them. We know from our groups, that our well-being groups, I should clarify, that when you include that in your overall communication strategy or well-being strategy, we see a tremendous increase in the number of individuals that are completing their preventive screenings. So again, that goes back to that medical home. We want them seeing their doctor. So doing something like that and actually putting that in.
And how do you structure that to make sure that you're not just getting people that already were doing it?
Yeah, I think you really got to integrate it into the culture, and you really got to talk about how, from an employer perspective, this is more about you and less about us as an employer group. We want to encourage you to really have those conversations. We provide you time to go have that appointment. So, I mean, there's a variety of strategies, and I would love, to have our team sit down with the account manager and talk to employer groups, because every employer group is different also on what might work. So definitely consider that preventive piece as part of the employer group strategy. And then knowing that there isn't a single program, but finding reputable programs and really promoting or offering to employees. Ryan, as we said, talked about Wonder Health. We offer coaching specific to weight management through our well-being vendor. It's called Positively Me, with very good results with working with individuals for weight loss. There's other programs like Weight Watchers and Noom. I don't want to say there's a single program that I would say, rise it to the top, but I think there are some things an employer group or a person should consider. Number one, if it sounds too good to be true, it is.
It usually is.
And people laugh when I say that, but anything that promises a quick fix is probably not research-based. It's not providing everything a person needs to maintain that weight loss, because that is the key, as we talked about, is losing weight, but maintaining. So there are some guidelines. We also know from research that social support is critical. So while there's lots of virtual programs, actually meeting with someone and getting the support and getting that motivation has been shown to have higher weight loss results.
How can an employer facilitate that social aspect?
Yeah, great aspect. We see employer resource groups being created. So having people with like interests, so whether it be weight loss, weight management, facilitating that community support at the work site or virtually. So I may not have explained it as well, but there is the component of that social support, but also some type of professional helping you understand the things that are going to impact your weight and your health the most. So when we talk about a coaching program or working with a registered dietitian, that's what they're going to do, is they're going to help you personalize your goals based upon your biggest struggles and hurdles. So hopefully that helps. I mean, there are very good programs out there. I know for Weight Watchers, I'll use that one as an example. I've had workplaces bring them on site and offer group meetings at the employee's expense. Now, again, we're more virtual than we used to be, but there are
Right.
ways to do that.
Is there programs where virtual dietitians?
There sure are.
Okay.
Yep. So there are community-based dietitians across Iowa and South Dakota that do offer weight loss programs. You can look in your local grocery store. You can work with your local hospital. Many of them are offering some type of structured program to help individuals lose weight. As an employer group, Kareem, I think if we go back and we say, how do we help our employees if we don't want to provide GLP-1s now? There are things such as, you can offer money back or pay for half the cost of the program if they meet certain goals. We've had employer groups do that.
Yeah. Which at the end of the day is still a lot less
Yes.
than probably paying for the
Exactly.
GLP-1.
The other thing, and this might be just enough, but lifestyle spending accounts, we have had people say, I'm going to offer a lifestyle spending account, and that can be used for weight loss programs. And so there are a variety of things like that to get creative. And I guess what I would share is we'd be more than happy to sit down with an employer group and find the right solution for them. It doesn't mean Wellmark provides it. It means it might be available in our walls or it might be community, but we've got to find programs and services that match the employer and the members.
Yep. And like you said, we can definitely help facilitate that
Yep.
and help find that for them. Awesome. Well, Julie, I think we're out of time unless you have anything else you want to add. Unless
No.
you missed something.
I mean, I could talk for hours, Kareem, so I'm going to spare you. I think the bottom line is it's ever changing, ever evolving, and I'm sure we'll have more conversations in the future.
No doubt on that. So thank you for joining me and exploring the alternatives that are out there for GLP-1 medications, and obviously that need to focus on behavior change. I think that's a big message, big point in the message you had. And I'm sure this topic will continue to evolve, as we just said. The epidemic of obesity isn't going away, and Wellmark is committed to helping our clients find programs and solutions to assist their employees, their members, to live healthy lives. So for those of you that are listening, if you have any additional questions or would like to explore the topic further, please reach out to your account manager. We can connect you with Julie's team, and Julie, I'm sure she would love to talk to you, as well as myself. Otherwise, thank you and have a great day.
Thank you.
So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.